It is so important, because the needs of society are changing, the models of care are changing. The NMC very recently reviewed its standards of education in preparation to prepare a workforce for the next 20 years. It's very much about working in multi-professional teams, working collaboratively, having good and effective leadership through nursing. And if we don't keep up with the new standards for nursing and nursing education, our nurses won't be equipped to look after the patients and service users that are coming into our care. There's no doubt about that. And those standards also apply to existing nurses. So somebody such as myself, who trained nearly 40 years ago, which was an awfully long time ago, but those standards apply to me. So it's not just important to bring in new nurses into the organisation and say, yes, that's great, you've got the new skills, you've got all the new training. We have to help the existing nurses develop the skills that are also required. Competences are changing, expectations are changing, and the needs of society are very much changing. And although we are a private organisation and we don't have the traditional pathways into care that perhaps an NHS acute mental health trust might have, we are still taking patients from those trusts. We're still funded by the NHS. These are patients and people and service users who live in England, who live in British societies, and we need to reflect the standards of expectation that have been set by the NMC. So it's really important that not just that we keep up, but it's important to our service users that we have that knowledge and skills and expertise.
I mean, I think Caroline's probably said it all there, really, in terms of why it's important. No, honestly, I think back to when I qualified. Sorry, Caroline, it was only 20 years ago. But it's so different, it's so changed, and I think that change and that ongoing development is what has kept me engaged as well, and that confidence in knowing that actually we're growing in the same way. As Caroline said, society's changed, people's expectations of what care looks like has changed. The presentation of the people we're entrusted to support has changed, and I think keeping staff motivated and feeling that they're part of that and that they are competent and confident to do it is just so important. And also for us to be really proud of the care that we're delivering. We talked about happy staff, happy teams, happier patient service users, and for people to come to work and feel really proud of the work and the care that they're delivering is really important, because that really translates for people. So Caroline said it's vital that we continue to grow.
One of the biggest changes is around physical health care. We know that the mortality gap, the life gap between people who suffer from mental illness or learning disability remains 15 to 20 years, and that hasn't changed since it was first counted in the 40s. And that's very, very sad that it hasn't changed, because in actual fact, physical health care has changed and is far more sophisticated. So it's actually how we address that gap, and that has to be through better understanding of physical health care, enabling our service users and patients to access physical health care, understanding when they are physically unwell as opposed to just not recognising it. So managing diabetes, cardiometabolic type disorders, and just general health and well-being, diet, smoking, exercise, all of these things which are now an expectation that all nurses will know and respond to and act upon, is new for mental health nurses. And so it is important that we keep up with the changes, if not just to address that mortality gap.
Yeah, and I think as Freedom Speak Up Guardian, I get people come to me because they want to have these conversations. They want to look at how they can change and improve and grow. And I think, like I said, there's an appetite for it. So I think it's exciting, really.
It is.
It is.
I'm still excited about it after 40 years. It's sad, isn't it?
It is exciting. And also, look, Cygnet has so many different services and so many different specialities, and I think being able to share the learning and to support services to develop and to support staff to find out what they really love and what they are best at is just, it's great.